All right, get ready, because today we're taking a deep dive into something you might think, phosphorus.
Phosphorus.
But we're going way beyond just bones.
Oh, yeah.
We're going to decode what those phosphorus levels really mean for your overall health.
Absolutely.
And get this.
Okay.
Phosphorus is a key player in how your body makes energy.
That's right.
It's like the behind-the-scenes manager of your own personal power plant.
Yeah, it is like the ultimate multitasker. Besides building strong bones,
Right.
it's also involved in energy production,
Mm-hmm.
DNA and RNA construction,
Wow.
maintaining the pH balance,
Okay.
and even activating enzymes and hormones.
So it's not just about keeping our skeletons happy.
Nope.
It's involved in pretty much everything our body does.
It really is.
All right, let's talk numbers.
Okay.
What's the typical range for phosphorus in our blood?
So for adults,
Okay.
the typical range is between 2.5 and 4.5 milligrams per deciliter.
2.5 to 4.5. Okay.
Right, remember those little ones running around?
Hmm.
They're building bone and tissue like crazy,
Constantly.
so their needs are a lot higher.
Makes sense.
For children, we see a range between 4.0 and 7.0.
Okay.
And infants,
Yeah,
well, they're basically growing nonstop,
they are.
so their range is even higher,
Got it.
often between 4.5 and 9.0.
So growing bodies need that extra fuel for all that construction work.
They need it.
But what happens when things get out of whack?
Hmm.
Let's say those phosphorus levels are too high.
Oh.
Is that a big red flag?
High phosphorus, or what we call hyperphosphatemia,
Hyperphosphatemia.
can definitely be a sign that something's off.
Okay.
It's like a flashing warning light
Uh-huh.
on your body's dashboard.
Gotcha.
One of the most common causes is actually kidney trouble.
Kidneys.
Your kidneys.
Yeah.
They're responsible for filtering waste products,
Right.
including excess phosphorus
Okay.
from your blood.
So they're like the body's waste management system,
Yeah, exactly.
keeping everything clean and balanced.
Keeping things in check.
Makes sense, but are there other reasons why someone might have high phosphorus?
You'd be surprised.
Really?
Your diet can actually play a significant role.
Like
Foods like
what?
dairy products, nuts,
Okay.
certain meats,
Mm-hmm.
they're packed with phosphorus.
And those are all part of a healthy diet, so
they are.
what's the problem?
Well, overdoing it
Okay.
can lead to those elevated levels,
Hmm.
especially if your kidneys aren't running at peak performance.
Hold on. Are you telling me my love for cheese could be messing with my phosphorus?
It's possible.
Wow. This deep dive is already full of twists.
There's more.
But what about other factors like certain medical conditions?
Yeah, absolutely.
Could those throw phosphorus levels off?
There are conditions
Yeah.
like hypoparathyroidism,
Okay.
where the parathyroid gland,
Right.
which helps regulate the calcium and phosphorus,
Uh-huh.
it's not producing enough of its regulating hormone.
Interesting.
And here's a curveball.
Okay.
Even a vitamin D overdose can impact your phosphorus levels.
Wait, too much vitamin D.
You got it.
I thought that was supposed to be good for us.
It is,
It's not
especially
good.
for bone health.
In the right amounts.
Okay,
But here's the catch.
okay.
Vitamin D,
Yeah,
it helps your body absorb calcium
right?
and phosphorus from your gut.
Uh-huh,
So if you're taking mega doses,
yeah,
you could end up absorbing too much phosphorus
gotcha.
and throw things off balance.
Wow, so it really is all about finding that sweet spot.
It is.
Too much of a good thing
Right.
can backfire.
It can.
But how would someone even know if their phosphorus is too high? Are there any telltale signs to look out for?
There can be,
Okay,
but they often mimic symptoms of other conditions.
like what?
You might have muscle cramps or spasms,
Okay,
that annoying itch you can't seem to scratch,
Yeah.
stiff joints,
Hmm.
or even persistent fatigue.
so not exactly a walk in the park.
No,
If your phosphorus is out of line,
not at all.
what can be done to manage high phosphorus? Well, it depends on the underlying cause.
Okay.
Sometimes simple dietary tweaks,
But what?
like reducing phosphorus-rich foods.
Okay, so cutting back on the cheese?
Maybe a little bit.
A little bit.
But in other cases,
Yeah.
your doctor might prescribe medications
Medications, okay.
known as phosphate binders.
Phosphate binders, what are those?
They bind to the phosphorus in your gut,
Okay.
preventing it from being absorbed into the bloodstream.
Ah, I see. That makes sense.
It's a pretty direct approach.
It is.
And in more severe cases,
Yeah.
especially if kidney problems are the culprit,
Right.
dialysis might be on the table.
So dialysis helps filter the blood,
That's right.
removes excess phosphorus,
Mm-hmm.
along with other waste products.
Yep.
Okay, so we've covered the high end,
Yeah.
but what about the flip side?
Right.
What causes low phosphorus?
Low phosphorus,
Yeah.
also known as hypophosphatemia.
Hypophosphatemia.
It can be caused by a range of things.
Like what?
Malnutrition, problems with nutrient absorption,
Interesting.
even excessive alcohol consumption.
Now that's interesting.
Yeah.
I wouldn't have guessed that alcohol could impact phosphorus levels.
It can.
What about those absorption issues?
Okay, great.
So are we talking about specific conditions
Yeah.
that interfere with how our bodies use nutrients?
Exactly.
Okay.
Conditions like celiac disease or Crohn's disease can impair your body's ability to absorb nutrients,
Including phosphorus?
including phosphorus.
Okay.
And unfortunately, chronic alcohol abuse
Yeah.
can also interfere with multiple metabolic processes,
Interesting.
including phosphorus absorption and utilization.
So it's not just about what you eat,
Nope,
but how well your body can actually process those nutrients.
it all works together.
Makes sense. But what about other more unexpected culprits? Are there any everyday habits that could be secretly contributing to low phosphorus?
There are. Really? Like what?
Believe it or not,
Okay.
overusing certain antacids.
Specifically, those containing aluminum or magnesium
Uh-huh.
can bind to phosphorus in your gut,
Oh, wow.
preventing its absorption,
Okay.
just like those phosphate binders we talked about.
Right.
And then there's the opposite of hypoparathyroidism,
Okay.
called hyperparathyroidism.
Hyperparathyroidism.
This is when the parathyroid glands are overactive,
Okay.
leading to increased calcium,
Yeah.
but decreased phosphorus levels.
So many factors at play.
There are.
It really highlights how interconnected everything is
It is.
within our bodies.
It's fascinating.
But how would someone know if their phosphorus is too low?
What?
Are there any warning signs?
There are,
Okay.
and some of them might surprise you.
Okay, I'm ready.
Muscle weakness
Muscle weakness. Okay.
is a common symptom,
Are
often accompanied by bone pain,
bone pain.
and in some cases even fractures.
That's scary.
Yeah.
So low phosphorus can actually weaken our bones.
It can.
I thought it was the opposite,
Mhm.
that we need phosphorus for strong bones.
We do.
Okay.
But when phosphorus levels are too low,
Yeah.
it can disrupt that delicate balance needed for healthy bone formation and maintenance,
Okay.
increasing the risk of fractures.
Gotcha.
And it doesn't stop there.
Oh, no.
Low phosphorus can also lead to confusion,
Really?
mental status changes,
Wow.
and even difficulty breathing.
These symptoms sound pretty serious.
They can be.
How is low phosphorus typically treated?
Well,
Is it similar to managing high phosphorus?
it is.
Okay.
The approach is similar.
All right.
Identify and address the underlying cause.
Makes sense.
This might involve dietary changes,
Like what?
like increasing your intake of phosphorus-rich foods
Okay.
or taking oral supplements.
Supplements.
And in severe cases,
Yeah.
especially in a hospital setting,
Right.
intravenous phosphate
The phosphate.
might be administered
Okay.
to quickly replenish those depleted levels.
Okay, so we've explored both ends of the phosphorus spectrum.
We have
High and low.
high and low.
And it seems like there's a lot more to it than meets the eye.
There is.
Interpreting these lab values isn't always straightforward.
Not always.
There are so many nuances at play.
Absolutely.
And that's where personalized context becomes crucial.
It's key.
All right, so let's dive into those nuances.
Let's do it.
What are some of the key factors that can influence how our bodies handle phosphorus?
Your age,
Okay.
gender,
Uh,
diet,
right.
even the medications you're taking,
Wow.
they all factor into the equation.
You all do.
For example, as we get older,
Yeah.
our kidneys, they might become a little less efficient
At-
filtering waste
at-
products,
Including phosphorus.
including phosphorus, exactly.
So a phosphorus level that's considered normal for a younger person
Right.
could be a bit high for someone older.
It might be.
And I bet certain medications can really shake things up, too.
Oh, absolutely.
I mean, are there any examples of that?
Diuretics, for instance,
Diuretics.
can increase phosphorus loss
Okay.
through urine,
Uh-huh.
while some antidepressants
Yeah.
can actually lower phosphorus levels.
Interesting.
It's a complex interplay of factors.
It is.
It really is.
This really underscores the importance of talking to your doctor
Yes.
about your individual results, right?
Absolutely.
They can help connect the dots.
Yeah.
Figure out what those numbers really mean.
Absolutely. That's key.
So seemingly unrelated factors in your life, your age, your diet,
Right.
the medications,
Yeah.
could be silently influencing your
Silently.
phosphorus balance.
You're right.
It's like a puzzle where all the pieces need to fit together
It is.
to get the full picture.
It is.
This is incredible.
It is.
We started with a seemingly simple blood test, and now we're uncovering all these fascinating connections.
It's a lot, isn't it?
And potential implications.
Yeah, it is.
But don't worry, we're not done yet.
We're not.
Stay tuned.
All right.
Because in the next part of our deep dive, we'll be uncovering even more surprising facts about phosphorus. And its impact on your health.
Okay.
Including its connection to something you might not expect.
Really? Your heart.
Heart? Wow.
Stay tuned.
All right. Welcome back.
All right, so before the break, we were talking about how these seemingly unrelated factors in your life can influence phosphorus levels.
They can.
It's like a chain reaction where one thing sets off another.
It is.
And suddenly, your phosphorus balance is thrown off.
That's right.
We talked about age, diet, medications.
Yeah.
But what about chronic illnesses?
Yep.
Could those impact phosphorus levels too?
Absolutely.
Really?
Chronic diseases like diabetes, liver disease, and even certain hormonal disorders can have a significant impact on how your body handles phosphorus.
It's starting to feel like phosphorus is at the center of so many processes.
It really is.
Could you give us an example of how a chronic illness
might throw things off balance?
Let's take diabetes, for example.
Oh, okay, diabetes.
In diabetes, the body struggles to regulate blood sugar.
Right.
And this can indirectly affect phosphorus levels.
Interesting.
Or consider liver disease.
Liver disease.
When the liver isn't functioning properly, its ability to process and store phosphorus can be impaired, leading to imbalances.
It really highlights the importance of looking at the whole picture, right?
It does.
It's not just about isolated numbers on a blood test.
Right.
It's about understanding how those numbers fit into the context of your overall health.
It's like trying to solve a mystery.
A mystery.
You need all the clues
to
get the full story.
I like that.
And speaking of mysteries,
Okay.
there's another fascinating aspect of phosphorus we haven't touched on yet.
What's that?
Its potential role in heart health.
Now that's intriguing.
It is.
I would not have guessed there was a connection between phosphorus and the heart.
It's an area of ongoing research.
Okay.
But some studies suggest that elevated phosphorus levels might be associated with an increased risk of heart problems.
The heart problems.
Particularly in people with kidney disease.
That makes sense.
Yeah.
Given what we've learned about the kidney's role in filtering phosphorus.
If the kidneys aren't working efficiently, it stands to reason that phosphorus could build up and potentially contribute to heart issues.
This is mind-blowing.
I know.
We started by thinking of phosphorus as mainly important for strong bones.
It's so much more than that.
And now we're discovering its potential impact on the heart.
Pretty amazing, right?
What other surprises does phosphorus have in store for us?
Remember how we discussed the importance of protein?
Protein.
In our diet.
Yeah.
There's a fascinating connection between protein and phosphorus balance.
All right. I'm all ears.
Okay, so
how does protein fit into the phosphorus puzzle?
Protein-rich foods are naturally abundant in phosphorus.
Okay.
So every time you enjoy a steak, a piece of salmon, or lentil soup, you're getting a dose of phosphorus along with that protein.
So does that mean we need to be careful about how much protein we eat?
It's about finding the right balance. For individuals with healthy kidneys, excess phosphorus from protein intake might not be a major issue.
Okay.
Their kidneys can usually filter out the extra phosphorus.
But for those with compromised kidney function, managing protein intake becomes more crucial.
It does.
So it's not about avoiding protein altogether, but rather being mindful of our intake, working with our doctors to determine the right amount for our individual needs.
Absolutely.
And remember, it's not just about the quantity of protein, but also the quality.
The quality, too.
Choosing lean protein sources and incorporating plant-based proteins can be a smart strategy.
It can.
It's amazing how even seemingly simple dietary choices can have a ripple effect.
They do.
On our health.
Right.
This deep dive has definitely made me more aware of the power of food and its impact on our bodies.
Amazing, isn't it?
But hold on, I have a feeling there's still more to this story.
You're right. There's one final piece of the phosphorus puzzle we need to explore.
Okay, I'm ready to uncover this final layer.
It involves going beyond the amount of protein and considering the source.
Okay, the source of protein.
Yeah, because it can have a significant impact on your phosphorus levels.
Interesting.
It's all about understanding this thing called the phosphorus to protein ratio.
Phosphorus to protein ratio?
Some protein sources,
okay,
like certain plant-based options,
yeah,
have a lower phosphorus content
yeah,
compared to their protein content.
So it's not just about how much protein a food contains,
right,
but also how much phosphorus comes along with it.
Exactly.
Got it.
For people looking to manage their phosphorus intake, especially those with kidney concerns,
okay,
opting for protein sources with a lower phosphorus to protein ratio
yeah,
can be a game changer.
I see.
It allows them to get enough protein
right,
without overloading their system with phosphorus.
That makes perfect sense. Can you give us some examples?
Sure. Think about things like egg whites,
Egg whites.
tofu,
Okay.
certain types of fish.
Fish, okay.
They're all great sources of protein without a lot of phosphorus.
This is really helpful. It's like having a secret decoder ring.
Yeah, I like that.
For navigating the world of food and phosphorus.
That's a good way to think about it.
But beyond specific food choices,
yeah,
what else can we do to support healthy phosphorus levels?
One of the most important things is staying hydrated.
Hydration.
Yeah, drinking plenty of water.
Right.
Helps your kidneys function well.
Okay.
Which is crucial
yeah,
for filtering out that excess phosphorus.
So the kidneys can do their job.
Exactly. And remember those phosphate binders.
Phosphate binders.
If your doctor has prescribed them, taking them as directed can make a big difference.
In managing phosphorus absorption.
Exactly.
It sounds like a combination of smart food choices, hydration.
Right.
And if needed, medication can go a long way in keeping phosphorus in check.
It can.
This deep dive has been an incredible journey.
It has.
We've uncovered so much about phosphorus. From its role in energy production and DNA construction.
It's amazing.
To its potential impact on heart health.
Yeah.
And its intricate dance with protein.
It really is.
It's amazing how much we've learned.
It is.
From just one simple blood test result.
It's a testament to the power of curiosity.
Curiosity.
And the importance of digging deeper.
Yeah.
To understand the complexities of our bodies.
As we wrap up,
okay,
what's the key message you want listeners to walk away with?
Phosphorus is an essential mineral.
It is.
That plays a vital role.
Yeah.
In countless bodily functions.
It really does.
Understanding your own phosphorus levels.
Okay.
In consultation with your healthcare provider.
Right.
Is crucial for maintaining optimal health.
And remember, knowledge is power.
It is.
By staying informed and engaged in your own health journey.
Absolutely.
You can make empowered choices that support your well-being.
You can.
Until next time, keep exploring, keep learning.
Keep learning.
And keep diving deep into this fascinating world of knowledge.
I'll see you then.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.